Ghana public health system no ashre enima P. To say emergency medical services.
We had a national ambulance service that was pretty much broken.
We are dear ne hadwempa.
You get up, go to the office.
Obe sorry anopa ako office. Obi frɛ wo nso a womfa. Esan se client no den a ombe frɛ. So mo pe ambulance. Na de obe kan kyerɛ mo nyinaa ne sɛ ye ni ambulance bia.
We hu nso no. Na eyarewosem. Ade hye bebree. Ana ye hwere wo mo.
Attempts to carry my chairman on the motorbike to get him to Agogo, which is the next biggest hospital. By the time they got to Agogo, the venom had traveled all the way to his heart. And so we lost him, unfortunately.
It got a point that people actually started not patronizing our services because they'll call and they'll have to wait for 1 hour. They'll have to wait for 2 hours and probably the whole day, and they won't even get the ambulance.
The Senti 2030 universal health coverage botayano. Danya Ghana into me enru.
As we went around from place to place, every place you go, the request will come, we need an ambulance, we need an ambulance, we need an ambulance. And it was a reflection of the fact that the National Ambulance Service had really virtually collapsed. And we needed to revamp it and make sure that we are not just buying ambulances, which will continue to serve just a few areas, but the idea was to buy ambulances that will serve every constituency in this country.
Pre-hospital care is very important because people either in an emergency fall sick, either at home, on the way, and before, a lot of things can happen before the person gets to the hospital, and that is extremely an important part of the care.
President akufo-addo Oshe say Obe Kenya National Ambulance Service no January busumi numu awa fimpenu ene dronumu no Odini Boshe so.
I'm really happy that finally this day has come to meet us. This is the day the Lord has made, and we should rejoice in it. This ceremony is a very good way to begin the year.
Ever since independence, we've never had 307 ambulances in the country. And this is international standard, not those kind of ambulances that we used to buy in the country. It is an international standard. So as a woman under the ministry that procured this ambulance, I thank God, and I also thank the President for giving me that opportunity because he has the vision and he asked me to implement it.
National Ambulance Servicer Professor Ahmed Zakaria Edano in Febe Brinuno. Atrensa Day Achepa.
We have every reason to be very happy.
I was saying, Nijipa, Esanse Ama Yujuma Ayemre, and Afinso, Abua Ama Ayarasa Aquanim, Titu Seba Emergency Services.
Hospital Emergency Care Services.
Anka ambulances any omeimua. Ghana sa na yetuetia COVID-19 kodi wono. Enka ebeji semkra amanapuso.
We transported about 1,130 cases, 1,130 COVID cases. And at a point in time, I was just wondering if by any means these ambulances were not in, then this COVID situation, it would have been so disastrous.
Ampa, abeko kromotia, yasano hobopa enyi.
Going by our motto,
Seni moto netieno. Timely care save lives. Esan sese bibi esia. This time round no. Yetimi ekodru biaya asem no esi no. Esan sese sia de. Ye wakade bia ye behia.
Now, patients who are arriving here in ambulances, all of them, there is a prior notification to our center here to inform the nurses and the doctors to be in readiness to see the patient. But some patients arrive here when beds are prepared for them, and we know sometimes the operational diagnosis, even on the ambulance or from the centers that they are coming with, so that we prepare for their management before they arrive here. And these are all translating in better outcomes.
Wey ensechi baba kwa abani ni agye pa.
I told the president on the days, Mr. President, tonight I will sleep. That is a key sort of expression, that kind language when you have become relieved of having solved a problem. You pause and say, tonight I will sleep.
I thank God for giving Nana Akufo-Addo this vision to bring all of this on board for this country, because ultimately you cannot put money on the cost on a life, right? The life is precious, and when you save a life, you have to thank God for that happening.
A man in Mema won't issue uniform ahabamuno. Any agini abino ayen pa.
I just want to say a very big thank you to
Nyampesa mekane se yeda mampenia sese weti yesofre.
Busumi awodo echira state-of-the-art ambulances ahasan sun 307 ebedru omayimu no. Yedi akwentuo no ebeko mantam no mu. Enkran pumpuni mantamu. Epoye mantamu. Asante mantamu. Etifi mantamu. Enafi etifi epoye mantamu. Ene yaba epoye mantam kura yefeno esikem ebehia Adelaide oredua na watwe kakra etwemu no. Eka de enka baba woy ehwere ne babema wodi busumi eduonu. Yefeno Ezekiel Adams. Adelaide ene ne ba nyina esori anopebi.
Sorry, I'm actually senior man. I Mr. was sorry them. Sinu ko friend to ma, mi rather my friend to mama. Me na shechiri. Sequence na mi rather am on ase. Me yam shame. Ti mi pia mi sister bi shia. Mas maro so ba na car bon. Which we on house car na park. Ti onu nu kura car na se. Ti do abeni na em.
Na drop beni no adwen se. Odene hyen no etwia fa abo bi so. Na onim se Ezekiel mum ena ode hyen no abono. Intietiemu bi a efri wona bonten ema Adelaide edi emika epia bonten. Eho ena kohu se moja pram ne bana etwa kese abada ntirim. Ane na no ho. Ana moja ne bi nso etne yo efa ne hwenim. Enimeni ho na no Adelaide efa ne babema no. Edne to sa hyen na mu. Edne ko Chebi Government Hospital.
Sanya Chebi doctor hu sanya community aye. Ene ne to kwa pa na ne ha. So pam ne to kwa na no ne ma ni no so ne tini die. I said the akufo-addo central. Now says I am a fee, Mrs. Simo. To be a family system, na my son call back. No, some of my friend blast. Semblance in the banner on the map.
When Imra, no we hear National Ambulance Service in Moa. Sinebeya, Wadi Abofrano, Ebako Iresabia, Irishe Ekonkai Eho. In Tempano, emergency medical technicians no. Ebefa abofrano won we hani nyina ejina ambulance sisia atwa pete abatoa mpeso bia so ewe pue mantem eno enema 1 hour golden rule no wotumi edi so.
Research has showed that, for example, the best chances of survival definitely will be getting the patient into a hospital environment, getting the patient into theater, an operation room for that matter, and be able to work on the patient within the 1 hour. Beyond the 1 hour, the chances of survival begin to diminish. So no matter how much time you spend in the pre-hospital setting, normally you don't do much help to the patient as compared to moving the patient to the hospital.
If you miss that 1 hour, if you are not very careful, the victim becomes a vegetable. If you miss it, that's the end.
Esanti bia na ne babema no ewo munti. Senkanye National Ambulance Service a enko be hwere ne ba no.
Je dru ono. Onom je me ba no koma nurse for o emergency o. Omo mujina ho a me ye akora no adwuma kakra. Ansa no mu tu ata. Abese ako. No abuwa me chese. Taxi ntimi fa on ko sa distance a short time. At ambulance there at least more than 1 hour 30 minutes there. In case of this problem, Send an ambulance, doctor being referred to also help. Our big hospitals are. Say, no man, no message. Then I put a personal and so that doctor being over here for land. So the taxi what they are. 10 for ambulance in and from Tabuami, 17 ambulance, either say, every balloon, once one I said, then a man.
Ezekiel Abasimi, impem 9 ediwatching cases are ambulance service are one Ewopoe Mantemu Ashe. Busumi watching Temua, 1 constituency, 1 ambulance, Anohopano, Wonya Wonchefano.
We're having 18 ambulance stations.
Near our ambulance stations do watching our Mantamunu. Nemra and Saka ambulances no. Yedi stations Nibika home our Mantamunu Emaniko do Edria Samiansa. And into which you say no yatsen kwa mopa. Na cases as say no. What the 2 cases are and maybe Chumuni na. Busumbi and yetimia bay 100 to 150. Nansu etrebia yetimia cause manable bay 300. Oh Busumintum. In Prempreno, ambulance stations are my munina, share patients be brave. Opening power with the National Ambulance Service. Professor Ahmed Zakaria edited just say, since be we echo.
If you look at the number of cases that already have been attended to, if you take a 5-year span from 2004 to about 2010, you will see that we attended to about 25 plus cases. Then from 2012 up to 2016, if you look at it, we attended to about 50 plus cases. But just in these 9 months, we've attended to over 19,000. Okay, almost 20,000. So if you just even make this comparison without waiting for even 4 years, you will see the number of cases that have already been attended to within this short period of time. And that is explainable. One, you now have more ambulances, you have more ambulance stations, and therefore you have more cases that you are attending to.
I've looked at some of the data from the National Ambulance Service on the calls. You will see that in fact we had a major decline over time of calls to the ambulance service, because people knew that if you call you wouldn't get an ambulance anyway for the most part. So if you look at the data, you'll see a major decline in the calls to the National Ambulance Service for ambulances. But since 2019, when you look at the data, you'll see a major jump in the call. And this means that the ambulances are saving lives, because as you respond to medical emergencies, you are saving lives.
Essence a poor mantem mantem baku Ghana ha. Lawyer Kunshia eto atese honinti. 1 constituency, 1 ambulance no abeboapa.
In an emergency or in a road traffic accident where there are injuries, the way people are managed is extremely important, how they are carried. For example, if you have a fracture, if you are not, maybe just a crack, if you are not managed properly, they can complete the fracture. If you are not managed properly, the bones can be shifted somewhere else. If you have a back injury, you have to be carried in a very special way. The way you are carried is extremely important. If that is missed, you can also cause further damage even before you reach care.
Ewa santimantemuno. Case bakwa, ebe trapia, na paramedics and regional heads eka wasem ene kwanya. Opinfo bia no onyi center for. Awo kanu a wotumi eje nkwa. Ni nyina esai National Ambulance Service inti. Secretary Afram Plains District Chief Executive Joseph Jemfiwusu ene din kan efre National Ambulance Service no edema opinfo ya na ofa ohamu pa no.
Eventually ambulance was dispatched, but because of the road conditions they cannot get into Fumsua town. So the locals had to devise a means to carry this pregnant woman on the back of a motorbike and bring her closer to the roadside. And if you walk through the video of when they were transferring her into the ambulance, it will amaze you.
Wanam kwansono, adia na woni nano esiye. Senior Ashanti Regional Administrative Manager, Edema National Ambulance Service, Somik Dat Milon Echechemuno.
This woman was pregnant with twins, and she actually delivered in the ambulance, and our emergency medical technicians were able to manage help her and assist her to deliver the twins. So they managed her until they got to Presby Hospital. So when the story came to my notice, I was like, so imagine this patient, this particular woman was still on the motorbike. How bad would the situation have been?
Esan say ambulances edosun ewa baton pesu bia so ewa maimu enenti. Timu no ambre say wonya baako emane be boa obey.
No matter how, where the person is calling from, the number of calls you receive, you'll be able to, get to the people within the shortest possible time. And that really gives us satisfaction when it comes to our work. Because somebody is in need and you are able to reach out to the person and to give the person the help that the person needs. In fact, it's more fulfilling than any other thing that, we can offer to anybody.
Welcome to Anochi Teaching Hospital no. Wana waji wantu ayaresa bia hono. Uche mwa, emu miensa no. National Ambulance Service no, ene de wonko. De bia no, ambulances beye eduonu mienu. 22, ene di patients, eko sa referral facility. Na Chief Executive Edema ayaresa bia no. Dr. Ohineba Wusu Danso, adwin ako bibisu a, ehye crime pa.
Our mid-year review conference this year, that is from January to the end of June, significantly, as against the trend for the last 3-4 years, we have recorded, for instance, a much lower maternal mortality. For the first time in such a period. And the research and the data analysis is still ongoing. But we can imagine that the ambulance service is having an impact in that domain also.
Inshemu achirese nyinsen mu wo no na ewo soro pa ni nyina esa entwentwen so nti abombeden so afo kwaku agima menu achirechiremu se Ghana ha no esa ambulances a na eniase no e ma sare hosem no ekoso pa.
The past we were hearing people delivering in taxis. So if they are now delivering ambulances, it's a good sign. People will wait and wait and wait until the baby is just coming before they call an ambulance, or they call an ambulance that wouldn't arrive in good time. So these things are normal things that happen in ambulances anyway. So if it's happening in an ambulance and it is not happening in the taxi now or in Uber, I think that is a good plus for the government.
Chief Executive, Edema National Ambulance Service, Professor Ahmed Zakaria, echechiremu say, "Sa oboa patient no ama sire aba woninim no, eye bibia, wonum atwen infe bebre ni."
Our satisfaction is really in the fact that now we have the adequate resources, we have the equipment, and we have a more motivated staff. Because every staff will be excited that you have the tools to work with. But it will have been very demoralizing if you had all the knowledge but you don't have the equipment, and before you a patient is dying and you are helpless.
What it says about the president and MPP government, that the president thinks about the health of the people.
I just want to be magnanimous, to tell Ghanaians the truth. The previous government didn't sleep about emergency preparedness. They were trying to bring ambulances. By virtue of their poor management systems, they couldn't.
Ambulance team no ashe cases bebre ewo Asante Mantamo.
We have about 49 ambulances now in the region. One, it has given us the luxury to reduce our response time.
What etifi Mantamo no, eni so a omanfo edema emergency medical technicians dwumedie no. Ekosro pa. Wonuma wenya muchefa echiremu fani nkebesi ho. Enka bato mpesue bia wo eni ambulance a. Yamfa Muhammad Al-Hassan enshase. Ne ukeni awu fie. Wa bra na otwen ambulance.
Lazo mobile. Na mi hu ntiri mi kura. Me ntumi anchenra sikosi se ambulance ni bedui.
Muhammad ekai ni team no eye ma ne yere. Edi Kenyan no ansa na wodi ne edru ayasabia.
Ansha na ambulance ni beduru no. Me yere wo ye. Na wo ye kire no. Na moje eturu me yere. Nti ambulance di omo stretch anyi bae. Na omere ni tusu. Na omdi ni wore ambulance ni. Mi so me yere mu. Nyansu na mi hu hye ochinkwam. Omo hwenu. Na ni shu chichi no. Nti ade ambulance na ya ma mi no. Meni shopa. Shenke nyomo a nka mi yere bewu.
Abrante ya yɛfrɛ no Abubakar Sadiq nso enya ne tiri didi mu efiri nkwanhyia bi mu na ne ohu ye ewa ambulance ebefa no mu no ɔde to dwa.
When we just land, the guy just crashed me.
Emra ye see from pe. Ena car bi ebo me. Amanfo mu gina no eyo ma so mefrɛ ambulance. Na simenum pentem no. On bedro. Omo farm e de me hospital ko ma me ndro. Enye ambulance service na akasa brim kama wuda dada.
Nyaba Al-Hassan Nayili ene ne yere efrɛ 112 a eye emergency number no na simadunum entemu no wonum ebeduru ho efa ne yere a na onyem ntafo e de ne ko Tamale Teaching Hospital.
We feel good because
Ini agye pa. Esa ansen ke befa ohaw bebre mu. Enu nti yeni agye.
Won nyina enya wontiri edidi mu. Kane no a enka obeka apemfo a wonum ato ananum e wonse do engu ntebuo no ho.
The main cause of maternal mortality is delay. And we have 3 delays.
At the teacher, the maternal mortality eba any delay. Now delays no yo mumiensa. Delays no bako any say. But for Kasamu, a delay in seeking health care, delay in accessing health care, and have a delay in receiving health care. Nti at the teacher in hear me any near Tosumienu. The patient no AC Juna years of a call Ayaresabia. Afe a ambulance service no asudi say. Wodi no beko Ayaresabia o. Na eno anso na ye ni sisia no. Ni senti ama maternal mortality so atekra e wo manten mu.
When nyina esisi esanse etifi manten mu no. Ambulance stations no dodo every enso ekodu wotwe. Na wei ama se bibisi a wotumi ekodu hontem. Eno nti enya won se call center e wo manten mu no. De bia won etminya calls. Beye enum eko eduonu.
You can have a district that can have
Ubetimi enya mensin bia ombenya ambulances mienu. Ni nyina gina constituency dodo a ewo sa mensin nu. Enhweso ne se wofa Tamale Metro a ye Tamale Central eni Tamale South ombenya ambulances mienu. Se woko Sagnelugu mensin mu a Tamale North ewo ho ena Sagnerigu constituency so ewo ho nti omuso benya ambulances mienu enu nti we abeboa ya response time no pa.
Even at the CHIPS compound, at the lower level, at the local traditional birth attendants, everywhere you find a maternal case where there are challenges and the patient needs to be referred, immediately the ambulance service is called. And so obviously, if you look at even with that concept, it's going to improve the maternal mortality tremendously.
Womantama ebenhono, mechire etifi epoye mantamu. Ambulance service a Ghana ban akanye mu no. Ehwe wona wonya lorry nkwanhyia. Titire ni wona wode tricycles, any motorbikes enya nkwanhyia no. Awuni Ali Baba a oye Upper East Regional Administrator Edema National Ambulance Service. Ebo so kire kwan a na kane bia etwemu no. Wontumi enye bibia.
All you could do is
Nya obetimi aya ne se ubema basic first aid. Ena ye den a ewo se odi omoto ehyen mu. Eno krampo no se ehyen na ye krado se obefa omo a. Eno ni ade a na ye.
Impempen no esa ambulances dunu mu a ewo mantam no munti. Bibia besi mantam no tokrobie mu no. Wotumi ekohwe. October bosome no nkwemu no. Wonum tumi hwe cases beye oha ene dunsun.
If you look inside this vehicle, you get to realize that if you
so ya kai mu a wa obehu se went to me anye adwuma ni ye a ene won se mfata se obehye uniform esan se ambulances no ete se moving theater
eno no krepa ambulances no theater edi akoniaba.
And that's why even COVID, we're even looking at probably using some of them to resuscitate those who may need ventilation. So there are many gadgets within that helps us in helping you to resuscitate in terms of defibrillators and everything are all in that system, and that is what makes it a state-of-the-art ambulance service. Not just a vehicle, but more like a hospital, a mini hospital on wheels.
Ene ye di EMT team no echi eko Bogatanga Government Hospital. Biaya obi a wenya accident. Eda esese wodi ne efri ho eko facilities no kubia ewo boko.
At the level of the neck, there is the cervical spine. So what happens is that if a patient gets an accident and the patient develops cervical spine injury and you don't handle the patient well, the patient can go into respiratory arrest and die on the spot. And that's why some die on the spot. The other thing is, if you have the lumbar spine also being affected, the patient can be paralyzed. So that's why they always advise that when there's an accident, it's always advisable to get the professionals to handle the patient. Because sometimes patient may survive the accident but die as a result of the handling. The other thing is extrication of the patient from the vehicle. Sometimes the patient is trapped in the vehicle. Some of the body parts might have been stuck to parts of the vehicle. And so in pulling the patient, you are likely to even damage some of the internal organs.
So binya nkwenhia na so benya ne tiri edidi mu a ne nyina ejina senia yesusom ewo biaya nkwenhia no esie no.
The care of an emergency patient is a continuum. The outcome, whether you live or you die or you get permanent disability, depends on what happens in the pre-hospital setting, and then the interventions that are made and the timely transfer to the definitive care facility. So I can say that without these ambulances, people would have suffered severe disability and sometimes death.
One in crime pumpuni mantemono. Senior omanfo ehia ambulance no e wasoro pa. Emergency medical technicians no te se won fefo no ma wo man Ghana fa aka no wo ye adwuma don hwere aduonu 9 de bia ene enanso e wona wotwe no mu senior be ya wo beso wo manfo sompa wonum atumrika nyansa wo mu senior be ya wodi won patient ebeko facilities ete se Greater Accra Hospital ene ye share patients gudu a wodi mfie aduasa nwotwe oye patient a wonum agina to a eka de enko hwere ne nkwa nanso ne abua no ani ambulance a e wona bato mpesu asunti patients sorry anopa bi no sorry no na ohun muja wa bra na wafa yefunu a edi busumi nsia enche bia ye betene nka na emom ne edikan no ye ni tima wonum ewo National Ambulance Service a wo hwe no no ebedi nkomo.
She had abrosial placenta. When you hear abrosial placenta, it's simply means the placenta has separated from the womb or uterus. So that one, you need urgent attention, or must to transport from that hospital to the higher hospital, either to rest the patient or to do cesarean section for the patient. So when we went there, we do our assessment and everything, and they said they are referring the case from Trobo Hospital to Rich Hospital.
Enyambo jankwa ene na 2 patients o. Ne na esa ha no ne se na na yasi eye ne yapa. Wen nyina echi no na nani eda soguso no hunu se ne wo hwe no e wo ambulance ni mu.
They treat me like a hospital. So I like the way they treat me. They didn't put me in the ambulance like that. They treat me well, like I'm in the hospital before I came here. So when we are coming here, the car broken away. They are talking to them that it's emergency, so it should give you a chance to come. So the way they do to me in the ambulance, I like it.
Principal Advanced Emergency Medical Technician Daniel Asari, any Greater Accra Regional Administrator, Edema National Ambulance Service. Ochire mu se wonum eje nkwa eya na eye ni gisem nkwa.
We the EMTs we work very hard.
EMTs ye adwumazin 24/7. They make sure there you be save lives. Onunti yet them cases yet the patients wa survivor oye hene ni jipa. O she nkwan yet won for there won ye adwumazin mesi mo be ya wo beje nkwa bebre.
Initially, some people thought the ambulance will not be brought in the country. When we mentioned it, even at Parliament, we mentioned that there was going to be ambulances procured in the country. People said no, we could not do it because we know we have doubting Thomases in the country. And when we even started bringing the ambulance, some people said they were not even up to the number. They were not even up to 50. But lo and behold, that day we commissioned 307 ambulances. And as we speak, All the 275 constituencies have ambulance each running every day in the constituency.
Say dear, patients are baba. Nanso, ankanya National Ambulance Service for na. Ankondo gidi say, ankansha obeshre nebano.
When I'm there, they say I came here. They say one of a lady, they want to brought in here. They want to call the ambulance, but they don't call ambulance. They brought the car. Before they came here, the baby was dead. So I told them that it's better for them to call the ambulance. If the way ambulance people help me, if not the ambulance people, this baby will not come out. So if you need ambulance, you can call them.
We want to assure the public that
Yepede yeshe public no bode. Every biara obenya emergency. One free 112 na wofra yeba ho ne abeye wonboa. Openipa wadan National Ambulance Service ano. Professor Ahmed Zakaria adwendwen yanka ebeto omaimu. Wabra COVID-19 kodi woi eyiniti senkakoba say ambulances are sanson in your omaimu.
That's one of the success stories the country can boast of. Because if you didn't have an efficient system to contain and be able to move these cases and avoid them from mixing with the general public, our cases would have even been worse. Because you can imagine if you have attended to and contained over 3,000. Imagine all these 3,000 will have had to go into various facilities through public means. You could have just seen the ripple effect. But being able to even respond at this time, we are very happy.
It has saved the country a lot. That's why you see that even the numbers in the country that are being affected by coronavirus is not that huge for us, because as compared to other countries, we've been able to manage, and it is because of this ambulance.
Apomode suafo onmunyamfo kweku agimamenu ewo nkuntebua odebetai djuma ambulance service no ediye wabra COVID-19 yade no anu ye din ewo man mu no.
The ambulances, as I speak, have carried close to over 3,000 COVID cases in our country. You know what COVID is. People wouldn't want COVID people to come into their vehicles. The initial stigmatization until now that we are getting over it. So without the ambulances, I sit back and ask myself, how could we have managed? This ambulance thing was God's intervention through our president, akufo-addo. Some people, we including me, have said in some occasions that the president was a blessing to this country. And when he talks about the matters of the Lord's, this is a manifestation of how the good Lord is fighting the battle for us. Not only fixing the economy, but helping us manage the pandemic the way we have done so. Right? Assessments across the globe indicate that Ghana, the way we've managed COVID, we ranked the first in Africa and third across the globe. It's phenomenal.
Omampeni abedi yechire die enye nkwa wonum agye no nkoa ananani agye ho nemum enwuma hodo a ambulance service edi aboman mu no.
The ambulances, as you know, you will have to, each of them has a driver, each of them has 2 paramedics and so on, and all of these have had to be recruited, and therefore definitely there is job creation in there, but you are creating the jobs to save lives.
With the coming in, there was recruitment of 1,400 plus staff, because we had financial clearance to recruit the first 550. After them, we had another financial clearance to recruit 900. So if you just look at even with that, it means that you've created jobs for over 1,000 people. And that itself is a plus on its own.
Abai no esre mfie 9 bio every Ghana for ensem senebeya apombudin asoye no wabedandan mu amana bo Ghana de shebia.
I'm not sure for now in the country we have any leader like His Excellency akufo-addo, bold, decisive and visionary.
We are working towards procuring another 100 next year, right? It may follow another 100 the following year. And that is how we may want to build on, saying that we don't go back to a situation we find ourselves in when we inherited.
We want to, of course, build upon what we have done or what we are doing. We have to protect what we are doing, build upon it, and do more. Of course, we are not where we ought to be yet. We want to see healthcare more accessible. There are many districts that don't have hospitals. We have Agenda 111, which means one district, one hospital. So there's a lot more that we want to do. We want to focus a lot on telemedicine, use technology to do telemedicine, and that is going to be a focus for us in our next term, God willing.